What does informed consent for Seroquel, otherwise known as Quetiapine, look like? My name is Dr. Ruth Doughton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as the importance of safety prescribing. And I'm going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So I did do a video about the atypical antipsychotic, so you can reference that for more details, but I do think Seroquel is worth giving its own video, and I've been asked for this, so here we go. So Seroquel is one of our atypical or second generation antipsychotics, and although this was originally developed as an antipsychotic, it actually has a lot of other indications as well. Similar to other atypical antipsychotics, it has a lot of activity not just on dopamine blockade, which is what we typically think of as having antipsychotic properties, but it also acts on serotonin, norepinephrine, histamine, so that's what leads to its other effects. So in addition to psychosis, we also use it for mood stabilization for bipolar disorder, as well as the treatment of mania in bipolar disorder, as well as the treatment of depression in bipolar disorder. It's also used off-label for insomnia quite a bit, and it can be used off-label to treat PTSD symptoms, as well as anxiety as a PRN or as needed medication. So when looking at the different indications, it's important to keep in mind the dose range. So Seroquel can range anywhere from 25 milligrams to 800 milligrams. So that's a big dose range, right? So when you're in the lower doses, like 25 to 150, 200 milligrams, at that point, you're getting more of the sedative hypnotic effect, so helping with anxiety, helping with insomnia, as well as some antidepressive effect. And then once you get into that middle range of like 200 to 400 milligrams, at that point we're getting into the mood stabilizing effect. And once we're at the higher doses, like 400 to 800 milligrams, that's where we're getting the antipsychotic effect. So if you're on Seroquel 25 or 50 milligrams, that is not acting as an antipsychotic. So I'd break the different side effects into three basic categories. One is the category that most psychotropic medications have, right? So this is things like headache, stomach upset, including nausea, vomiting, diarrhea, GI pain, dizziness, dry mouth, dry eye, fatigue, sedation. And with the Seroquel, it is particularly sedating, one of our most sedating medications. And so that's why it's used as needed for insomnia. Then you have the cluster of extrapyramidal symptoms as a side effect. So these are things like movement disorders, like having a tremor, having uncontrolled muscle movements, having tardive dyskinesia, which is where you have these uncontrolled muscle movements that develop over time. So think about people who are constantly lip smacking or blinking. There's dystonias where you can have an abrupt contraction that you can't undo. So torticollis is the dystonia of the neck muscles. There's also Parkinsonian symptoms, things like slow gait, slow movements in general, muscle rigidity, tremor, masked facies, which is where you have no expression on your face. Now, this cluster of side effects is much less likely with Seroquel than some of the other antipsychotics because it has less strong of a dopamine blockade. That doesn't mean it never happens, but I'll say it's relatively rare with Seroquel alone. And then the last cluster of symptoms is the metabolic side effects. So this is increase in appetite, weight gain, changes in cholesterol, blood sugar. So Seroquel is one of the worst offenders for this class of side effects. And even at the low doses, like 25, 50 milligrams, which are used primarily for insomnia or for anxiety, they can still have these metabolic side effects even at those low dosages. So this is certainly not a low risk medication, and I do see it prescribed pretty flippantly for things like insomnia, anxiety. And so although it can be really helpful for people, I always want to make sure that the potential benefits of this medication are going to outweigh the risks, which is why I try to stick to prescribing it to people who have bipolar disorder or a psychotic disorder. Other things to keep in mind, of course, with any antipsychotic, there's going to be the potential risk of neuroleptic malignant syndrome. Again, this is going to be less with the Seroquel because it has less strong of a D2 blockade. We need to monitor for SI, as well as keep an eye on the heart rhythm with a routine EKG because this medication, like the others, can cause QTC prolongation. This medication does require annual labs to monitor your blood counts, your liver function, your kidney function, your electrolytes, your blood sugar, and your cholesterol. As far as trying to taper off of this medication, because it has so much antidepressant activity, the potential withdrawal symptoms are going to be similar to can happen with an antidepressant. So it often requires a slow hyperbolic taper, just like an antidepressant would. So after going over all of this with the patient, we would talk about whether the risks versus benefits made sense for them, and we would make a shared decision from there. If there's another psychiatric medication that you want to hear the informed consent process for, then please put it in the comments below. I'm also starting an email list so that I can communicate more directly with people who are interested in my content. I may be having future offerings or courses or resources that I want to be able to share with you all, and so that just would enable me to do it. I promise that I won't spam you. Wish you all good mental health, and I'll see you in the next one.